Good evening. Welcome to the extraordinary executive meeting of Woking Borough Council on the 25th of February 2021. Just a little bit of housekeeping. Please ensure that any mobile device or mobile phones are switched off. If you're not speaking or being asked to speak, please mute your microphones. If you do not mute your microphone, it will be muted for you. To assist viewing the meeting, could everyone turn off their cameras and only turn them on when speaking? And also introduce yourselves whenever you speak. To ensure the smooth running of the meeting, could members wishing to speak use the hands up facility on Teams wherever possible. Please note that the meeting is currently being webcast live. I'm John Halsall. I'm the leader of the council. Tonight there are John Kaiser, the deputy leader and executive member for finance and housing, Parry Bath, the executive member for the environment and leisure, Ulla Corinne Clark, the executive member for children's services, Charlotte Haytham Taylor, the executive member for regeneration, Pauline Jorgensen, the executive member for highways and transport, Charles Margetts, the executive member for health, wellbeing and adult services, Stuart Monroe, the executive member for business and economic development, Gregor Murray, the executive member for resident services, communications and emissions, and Wayne Smith, the executive member for planning and enforcement. Officers supporting the meeting tonight are Susan Parsonage, the chief executive, Andrew Moulton, the monitoring officer, Madeline Shopland, lead tonight for Democratic and Electoral Services. I don't believe that we have any apologies. Just before we start, just make a few remarks. The weekly rate to the 20th of February in Wokingham is now 48.5 today, which is well below the peak of 606 on the 4th of January, but still compares very badly to the below 5 in August. We suspect that we will hover around this figure for some time. Happily, both hospitalizations and deaths are also stable. Our lives have changed unrecognisably for some, and many lives have been so sadly lost. I can only restate my condolences for those who have suffered so much. I would like again to say a big thank you to everybody who stepped up to the plate and made it possible for life to continue during these appalling times. It has never been more vital that we play our role and continue to observe the rules. Earlier this week, the Prime Minister made a statement on a roadmap for easing lockdown restrictions in England. Vaccines are at the heart of the government's strategy, with 17 million people having received the vaccine. The government is taking a cautious approach to easing lockdown, guided by the data to avoid surge infections that would put unsustainable pressure on the NHS. When moving from one step to another in the roadmap, the government will examine data to assess the impact of the previous step. This will be based on 4 tests. The vaccine deployment programme continues successfully. Evidence showing vaccines are sufficiently effective in reducing hospitalisation. Infection rates do not risk a surge in hospitalisation. Assessment of risk is not fundamentally changed by the new variants or of concern. As we move forward on the roadmap, the Council will have a central role in its success. Moreover, this is part of our recovery strategy. For example, rolling out the vaccination is critical. We are doing all that we can to enable this with our health partners. Expanding and scaling our community testing offer on lateral flow testing will be crucial, building on the Shoot End and Microsoft sites. As we know, 1 in 3 people are asymptomatic. To be successful, this testing needs to be part of everybody's daily routine. We need to change the behaviour and continually check for positive cases, so that these cases can then self-isolate. We need to have an enhanced tracing regime to ensure that those residents who are positive do self-isolate. We need to be rapidly deploy thousands of PCR tests door to door should the data suggest we have a problem in the borough. Also, to maintain our excellent support to groups particularly at risk from COVID, such as those in care homes. At the same time, we need to address inequalities, ensuring, for example, that those disenfranchised are testing and receiving vaccinations, and that we're addressing the vaccination hesitancy. Therefore, as part of our recovery and outbreak management, we need to have a tailored approach to our communities. Mr. Dunham, could you turn your video off, please? Alongside our efforts on COVID contained as part of our recovery, we're also focusing on the following areas: supporting businesses and stimulating job creation and skills, physical and mental well-being, maintaining resilient and sustainable services, harnessing digital and data for insight, focusing on children and young people and education, inequality and social inclusion. We're already moving forward and taking action on these recovery scheme themes, and a report will be brought to the executive on action taken so far and future action. At the council in February, I stated the budget put forward was a budget for recovery. It provides almost £500 million over the next 3 years for investment in our community, and a considerable amount of this will stimulate our local economy and seek to address the housing needs in the borough for those not currently able to afford to buy their own homes. The budget also provided considerable additional ongoing investment into our care services, including the likes of domestic abuse service, to ensure that we can support our residents in overcoming the fall out of this terrible virus. You may also be aware that we've done much work recently on our poverty strategy, our equality strategy, and these are also a critical part of our recovery strategy. The main item today is the Council's approach to COVID as reviewed by the Overview and Scrutiny. The administration believes that overview and scrutiny provides a vital function for our decision making in our democracy, and has sought to ensure that it is far-reaching and unfettered in its work. For example, the budget now is reviewed by ONS prior to adoption over a period in excess of 6 months. Thank you to all the officers involved and the work of overview and scrutiny in reviewing our COVID response, as we can always learn more. Thank you very much. And now, may I ask for any declarations of interest? No? I don't think the companies are figure tonight. So we move on to the public question time, and David Dunham asking a question of Pauline Jorgensen. David Dunham.
Yeah, good evening, everybody, and thank you for letting me ask this question. We're currently running an extremely successful vaccination programme in the borough of Wokingham. At the Bradley Centre, every vaccination day, we're averaging 1,000 people being vaccinated. However, there's been a number of comments from volunteers and people attending that they're finding it very difficult to park in the Rose Street car park, as we're only allocated 14 spaces, and we're actually vaccinating 8 people every 4 minutes at the vaccination centre. I just wondered if the council feel that it's possible that just on vaccination days only, that Rose Street car park could be allocated en bloc to the vaccination centre, especially at the moment, as obviously there's many fewer numbers coming into town because of the current lockdown situation. Thank you.
Sorry, thank you for your question, Mr. Dunham. The way the parking in that car park works at the moment is that we've set aside some space for people who are getting vaccinations, and that is being managed to make sure that people who aren't getting vaccinations are not going to be parking in the area that's allocated. I'm very happy to take away a suggestion and see if there's enough space there and make adjustments to make sure that there's enough space for the people who are being vaccinated.
Yeah, thanks, Pauline. But currently we have 14 spaces allocated in that car park. And just going back to what I said, if we're having roughly, not everybody drives, I understand not everybody drives up, But if we're having 8 people every 4 minutes and they did happen to drive, that potentially could be at the most 32 cars. And with the vaccinations, they have to sit for 15 minutes, as you're probably aware, with the Pfizer indoors, and not drive, to sit in their cars for 15 minutes with the other one. So, and we're also having problems. The parking wardens have recently been hovering, shall we say, to see those that aren't parking in those allocated spaces. 5 of those 14 spaces are also disabled spaces, which are the ones right next to the old M&S building. So we don't want to put anybody in those. We want those, they still need to be for disabled people. So, yeah, I mean, it's just a case of really, they could do with another line of spaces, that's all.
Okay, well, let me take it away and look at it, David. I'm very happy to make sure there's enough parking. We obviously don't want to provide too much because we want to make sure that everybody's able to use the car.
Cool.
We'll make sure there's enough.
That. Yeah. All right, that's lovely. Thank you very much.
Bye.
Bye.
And Chadwick, question to Lucrin. And Chadwick?
Hello, sorry about that. Hi, Lucrin. Yes, my question is about it's the Children's Services section of the report, and I noticed that it states that the majority of child protection visits remained face-to-face in June 2020 at 97%. And I just wondered how have child protection visits been conducted during the latest lockdown?
Okay, thank you for your question. I have a rather long answer for you.
All right.
Throughout the pandemic, children's social workers have been committed to undertake visits face-to-face and see the children in person. And seen in the high number of face-to-face visits that were completed during periods of national restrictions. Children's social care developed a set of practice standards that provide a structured decision-making process in relation to all visits to children to ensure that any risks are mitigated. The standards highlight that all children subject to a child protection plan will receive face-to-face visits within the usual statutory timelines, frequently if required. There are exceptions, and they are if a member of the household or placement has symptoms of COVID-19, or there is a confirmed case of COVID-19, or if they are self-isolating. When any of these circumstances arise, a COVID-19 visiting and PPE risk assessment is undertaken by the allocated social care worker and their team manager. And this will give them information, the risks to the child, the risk to families, risks to the workforce, national guidance on social distancing and hygiene, and the statutory responsibilities, including safeguarding. So any decision to undertake a virtual visit requires management oversight and agreement. Since the 1st of January this year to the 19th of February, a total of 783 child protection visits have been completed by Wokingham social workers. Out of this number, 5.4% have been virtual and 94.6% of visits have been undertaken in person and face-to-face by a social worker. So I think you will agree that we are doing our very best to ensure we have everything covered.
Indeed. Thank you very much. Thank you.
Do you have a supplementary, Anne?
Beg pardon?
Do you have a supplementary?
No, I don't actually, no.
Thank you very much. Daniel Hinton, Charles Margetts.
Thank you, John. Charles, good evening. Can you please provide an update on the current level of COVID in care homes across the borough?
Evening, Daniel, and thanks for your question. At the start of the pandemic, Wokingham Borough Council set up a specialist adult social care COVID-19 task force made up of WBC employees. They work closely with all the care homes across the borough. Since then, this team has provided vital support to care homes and their residents, ensuring they stay as safe as possible, and particularly trying to support them when we've been in the situation of having outbreaks. From daily calls to sharing information and assisting with issues and concerns, supporting with risk assessments, problem solving and testing, the team is there to assess the needs of everybody and to put support in place when it's needed. Working in close partnership with our local providers, we're now seeing, fortunately, very low COVID-19 case numbers in the borough. Across our 52 care homes, which is a lot larger than any of the nearby boroughs, there are currently 2 COVID positive residents and 3 COVID positive members of staff, which is a vast improvement on where we were a few months ago. Following a peak in the case rate in Wokingham at the beginning of January, the rate has now fallen steadily. We're below the national and southeast comparable rates. As the leader said at the start of the meeting, the current rate is below 50 per 100,000. And most encouragingly of all, the rate in residents over the age of 60 is now hovering around 30 per 100,000, when the average across the southeast is 69.8. And as I'm sure you're aware, central government has announced this week that care home residents will be permitted 1 designated visitor from March the 8th, which is obviously very good news. Our task force will continue to work with care homes and colleagues from the sector to minimise the risk of community transmission and to ensure that lateral flow testing is available and to fully facilitate anyone who is the chosen visitor.
Do you have a supplementary?
I do. Thank you, John. That's great news, Charles. Thank you for that. It's great to hear the COVID cases are down in care homes. Does WBC have a message for residents to ensure that this forward numbers continues going forwards?
Yeah, I mean, the situation's very encouraging. And as I said, we are generally below the Berkshire average, the South East England average, etc. But, you know, that's been achieved for a reason, because people here generally have been following the guidelines, keeping 2 meters social distancing, wearing masks when appropriate, and, you know, washing hands properly. And it's really, really important, if we want to keep downward pressure on the rate as hard as possible, to do those things. And if you're called for a vaccine, please go, because that's the way out of this. So, yeah, that's very much the message at the moment.
Thank you, Charles.
Thank you.
Thank you, Daniel. Sam Akhtar for me.
Hello.
Good evening, Sam. How are you?
Good evening. So my question is, the council navigated a firm course through the emergency, looking after the needy, protecting the residents and standing up for the borough where necessary. I'm genuinely delighted that the executive had the strength of conviction, so well done. But how prepared is the council for recovery, and what is its strategy?
Thank you, Sam, for the question. It is pleasing and reassuring to hear your appreciation of the council's response to the pandemic. It means a lot to know that our endeavours were felt amongst the community at such a vital time. Our response is not over yet, of course, so we must keep focused on this and doing all we can. And as you rightly point out, the council also has a key role to play in recovery. At council in February, I stated the budget put forward was a budget for recovery. It provides almost £500 million for the next 3 years for investment in our community, and a considerable amount of this will stimulate our local economy and seek to redress the housing needs in the borough for those not currently able to afford to buy their own homes. The budget also provided considerable additional ongoing investment in our care services, including the likes of the domestic abuse service and mental health, to ensure we can support our residents in overcoming the fallout of this terrible virus. You may also be aware that we have done much work recently on our poverty strategy and our equality strategy. These are critical parts of our recovery. In March, we will be refreshing our vision and corporate delivery plan in the context of the impact of COVID-19 and the need for the recovery. In May, I hope we will be able to bring a specific recovery strategy to the executive that identifies our key themes for attention. Most of the recovery work is, of course, already progressing. For example, improving our offer to low and medium health support, stimulating economic recovery, and helping our children achieve their development potential. However, this strategy will help us to bring all these work streams together and ensure they're not forgotten as we embark on our significant role in helping create a brighter, purposeful, and happier future for our whole community. Do you have a supplementary, Sam?
No. Thanks, John.
Thank you very much for the question. Shahid, for me.
Thank you, Chairman. I'm Shahid Yunus, a resident of Bulmesh and Whitegate Ward in Woodley. My question is to the Executive Member for Resident Services, Communication and Emissions. Woking is one of the affluent places to live, work and bring up a family. However, in certain wards, 17% of children live in poverty. What strategy does the Council have in place to reduce child poverty across Woking Borough Council?
It's really a question for me.
Okay, that's fine.
The executive agreed the Council's approach to tackling poverty at its meeting in January 2021, and work is underway to better understand the causes and effects for residents and families in the borough, and what we can do more of to improve the outcomes for all. Child poverty will be a key consideration, and actions to reduce poverty generally in the borough will positively affect children who may be living in poverty because of their family situation. Regardless of whichever statutory benchmark you look at regarding poverty and hardship, Wokingham still has one of the lowest rates in the country. But even if one person or one child does not have fair and equal opportunity in our borough, that is one too many, and we are committed to fighting this. We are already doing a lot to address this issue. We are not starting from scratch. For example, we've made good progress in addressing the drivers of poverty through maximising affordable housing, providing good quality council housing and addressing homelessness to ensure families and children have access to safe and secure accommodation. In fact, I would add that we are increasing at the executive next week or week after, we'll be putting to a paper to increase the amount of council homes that we're building. We also have a scheme in place to alleviate the impacts of fuel poverty. The scheme has benefited a number of our households through energy efficiency upgrades to homes, which could save residents more than 30% of their annual fuel bills. These savings can help improve financial security of families, which will directly benefit children. Another example is through our outreach work. Often in partnership with the voluntary and community sector, we support our residents to lead self-sustaining lifestyles, including addressing food insecurity through initiatives such as the Grub Club and Social Bites, which has positive benefits for children. Notwithstanding this positive work that has been taking place and is being strengthened in response to the pandemic, we know we can do more to ensure that those who really need our support and help get it. Do you have a supplementary, Shahid?
No, John, thank you very much for your response.
Thank you. And now Gary Cowan, question to Charles Margetts. Is Gary Cowan there?
Yes, John, I am here.
Put your camera on.
Sorry? It's not working. It's not working.
Ah. Okay, far away.
Oh, the question is recorded with Charles. It's not showing on the agenda, so I can't read it out verbatim. So I'd leave it for Charles just to answer.
Would you like me to ask the question, or read the question out?
Yes, so, please. That would help. That would be helpful. Thank you, John.
Care home in Woking usually run by private or voluntary sector service providers. Woking Borough Council has a responsibility to support the needs of the individual and maintain the financial sustainability of the social care market. It does not have a direct responsibility to manage an outbreak within a Wokingham care home, but has continued to support providers to manage outbreaks during the pandemic. From the start of the pandemic, the council has worked proactively to deliver support and advice to care homes and other care settings in the borough. Adult Social Care has provided support to care homes through its Care Home Task Force, providing guidance on infection control, support with PPE, distribution of government grant funding, and immediate targeted support in the event of COVID-19 outbreaks. My question is, the council satisfies that it has worked just as proactively to deliver support and advice to our residents in the vicinity of care homes where there has been reported cases of infection and sadly loss of life in the borough?
Okay, thank you, John. Thank you, Gary. Yes, care homes have been particularly vulnerable to COVID-19 outbreaks, but most of all at times when rates of infection are high in the local community. High community rates of transmission increase the risk that staff or residents leaving the care home contract the virus, with subsequent onward transmission within the care home setting amongst those who are elderly and vulnerable. Outbreaks in care homes have been managed effectively and contained through all the necessary infection control measures and public health action to manage the risk of community transmission. Throughout the pandemic, the council's worked in partnership with local residents and businesses to minimise the risk of community transmission. Measures have been introduced throughout Wokingham, including physical barriers to manage pedestrian flows, signage, targeted communication, and COVID marshals. The activity of the marshals has been directed by public health data and local intelligence to ensure resources are deployed where they have been needed. This obviously includes where we've had large outbreaks. Our COVID support team work closely with the police, localities, towns and parishes to ensure community compliance, and we've completed over 3,000 business and safety inspections. Wokingham's local case tracing service, which is part of the NHS track and trace system, has enabled the council to ensure welfare needs are understood and that residents have been signposted to services to support their needs. At the time of writing, we've made 416 successful self-isolation calls. That's led to 101 people being referred to the One Front Door system for further support. The service aims to reach residents within the borough to ensure the support is made available in a timely fashion to fully support those in the unfortunate situation of having to isolate. In addition, we've launched our lateral flow rapid testing programme to all key workers in the borough. There are currently 2 centres open, with a third due to open shortly. The aim of this is they can work safely and we can better control and identify the risk of the spread of infection. This so far has done more than 4,000 tests. Where we've seen care home outbreaks, the council has targeted resources within the local community. This has included additional marshal patrols, an addition in signage, with staff working alongside local residents and business to highlight risks and to ensure compliance. For example, when there was an outbreak at the Shinfield View care home, we arranged daily COVID marshal patrols and located 4 large temporary feather signs in Shinfield, outside key shops and the garage, and a number of additional standard signs to reassure the community and to try and send the right messages out locally. Gary?
Yes, John.
Do you have a supplementary?
Yeah, only to say that since I submitted the question, I've been looking quite carefully at the work as best I could see that Wokingham have been doing, and listening to Charles just then, and you, thank you for putting my question forward. You better get a G&T ready. I think you're doing an excellent job. No supplementary question, and congratulations to all of you.
Thank you, Gary. Noted and understood. And yeah, we aim to obviously keep going and make sure that we're providing the support needed to not only those in care homes, but those in the localities around them, basically, till the end of this pandemic. But thank you.
And it's noticeable. Well done.
Thank you.
Thank you for the question, Gary. And we now come to the question, the main body of the meeting, which is the officer response to the recommendations from the overview and scrutiny report. We were to meet to bring the equalities paper also here tonight, but it's had a little bit of a rewrite, and so we'll come to the next executive meeting. So that's the only item of business we have, and I invite Pauline Hellyer-Simons to talk about to introduce the report on behalf of the Management Committee.
Sorry, Chairman, I have a question for Charles.
It's not for now, Ulla Grin.
Okay, all right, I'll wait. Sorry.
Thank you. Good evening, everyone. I'm Pauline Hellyer-Simons, the Chairman of the Overview and Scrutiny Management Committee. I have real pleasure in presenting this report on what the Council is doing to address COVID-19, and we have taken on board all of the officer comments that were presented to us, although in fact they were all extremely positive. I've nothing but praise for the degree of detail and research that went into compiling this report. The information in it came from the other scrutiny committees to tell us about the work that their areas are doing, as well as lengthy questioning and discussions at our overview and scrutiny management meetings. I was particularly pleased that we were given the feedback and the results of the resident survey, which was extremely positive and complimentary. We considered 12 areas, and they are itemised on page 7 of the report, but I'd like to pick out just 3 as examples of what we were particularly concerned about: the impact on people's mental health, poverty, especially for those experiencing poverty perhaps for the first time, and care leavers needing exemption from council tax until the age of 25. And we were pleased to see that these and all of the others are being progressed and in many cases have already been achieved. In fact, the care leavers council tax issue and the anti-poverty strategy were already happening even before we finished our work. We were also pleased to see that staff welfare has been a key priority throughout, and there is an employee assistance programme with 24/7 helpline. We also received information from the officers' feedback that 45 employees are training to be mental health first aiders. And that's a course that I've now done myself, by the way, and found it extremely enlightening and practical. In our discussions in the committee, we gave praise for the way the council has worked with its partners of all kinds, and we expressed the hope that this would continue and develop, and that we would also continue and develop and support the lessons that we have learned over the months. And so I added 2 addendums to the final report along those lines. We felt that the council has done a superb job in coping with this pandemic. There's already a recovery strategy, which the leaders briefly referred to, and that's flexible enough to adapt as circumstances change. I was extremely pleased that there was cross-party agreement on all that we discussed and on the report as a whole. And I'd like to thank all the members of the Management Committee for their commitment to this work. For the future, the resident survey mentions 3 priorities that are important to them. Firstly, supporting local business and employment. Secondly, supporting mental health. And thirdly, reducing social isolation and loneliness. I know we are already working to do these things, but it's good to know that they are important to their residents too. I have pleasure in presenting this report to the Executive.
Thank you very much, Pauline. Any questions, Pauline? Pauline? PJ?
Thank you. There's a surplus of Paulines here, isn't there? Yeah, thank you very much, Pauline. It was a really interesting report. I've got a question which might be for John or the other John, actually. One of the things that this report reminded me of was the fact that in a crisis we had very fast decision making, and also that we had some really innovative solutions. It takes my mind back to the beginning where we bought an extra supply of tests for key workers, where we provided PPE for those who needed it, where we thought they probably couldn't buy it on the open market, and we actually have then introduced subsequently lateral flow testing. All of these things cost money, and I wonder, John, if you could explain how we've managed to pay for all this, given the fact that the authority is the lowest funded in the country and every penny counts.
Well, Pauline, I mean, we did start this pandemic with probably the highest, with actually the highest reserves that this council's ever had. So we were well placed going into it. But I would just say that thanks to a number of issues, which I think they need to be mentioned here tonight, we didn't allow a crisis to turn into a disaster. The first was the staff and how adaptable they were, and how they were happy to move into being redeployed to support our care workers and to support adult social care. The people from when we closed down all the leisure centres, that meant that we didn't have to go out and take on board very expensive temporary staff. The support we got from the charities, I especially mention the Citizens Advice, and of course, and after about 3 or 4 weeks, the grants for businesses kicked in, and of course the government support for us also kicked in. Now, government support didn't cover everything, but we still managed to make a saving during the year, and I would say that was more or less due to the officers and adapting the way that they were all working. It's cost us £2 million on leisure that we're still fighting to try and get back, because of we outsourced our leisures, and we had to meet the commitment. If we hadn't, all our leisure centres would have closed, possibly never to have opened again. And the other thing that I was very pleased with, that we got all the rough sleepers off the street, and we did that within about 2 weeks, which I think there was one left on the street, and we continue with that programme today. And the government's obviously recognised how important it is, and we've been awarded nearly £1 million to enable us to take that programme forward.
Okay, thank you very much, John. I think that just highlights that you've done some pretty fancy footwork to actually get all the things to add up and provide the services that are needed. So thank you.
I can say when we were having our first meetings, Pauline, and we were meeting with the leaders from the other groups, the numbers were quite scary. But as time has gone on, we've managed to cut our cloth, and of course, as the government money comes through, and as I said, it doesn't cover everything, it put us in a lot better position.
Great, thank you, John. Thank you, Pauline.
Charles.
Thank you, John. I thought it was just, and thank you to Pauline Helios-Simons and the Overview and Scrutiny Committee. I thought it was just worth picking up a few points and strands basically from the report, because obviously this was the product of meetings over summer to late summer last year, and obviously the pandemic has gone on a lot further than that. So, I mean, my view on this would be I'm very fortunate to work with a very dedicated and committed group of officers. This is far more than one person, this is a whole team who've adapted and moved forward basically with this to the changing situation. You know, the voluntary sector response has been mentioned, which obviously initially focused on food deliveries, prescription deliveries, things like that. And of late, it's completely changed. You know, now it's focused on supporting the vaccination program, you know, supporting the lateral flow testing program, those people you're seeing out car parks basically when you go outside. This is all being organised and managed by the officers in the council, basically encouraged and trying to harness the best of the voluntary sector with the things the council can do. And it's going to go on as long as this takes. None of this would have been possible without our partners in the voluntary sector, You know, the list is numerous, and if I miss any out, it's not through want, just forgetfulness, but first days, the link with their friendship calls, the council staff who've made support calls to people, the Working and Volunteer Centre. I have to attend a meeting with the PCNs every week about vaccination, where I hear the leader from the Working and Volunteer Centre, Nick, every week say to them, I've got the volunteers, when can you give me vaccinations for them? You know, they're driving this thing forward. And, you know, obviously the CAB. But I think final thing I would say is none of this would have been possible without the people who volunteered to help, whether it's delivering on a basic level, where it's working in the food hub, delivering basically prescriptions, giving up their time for free, or now standing in the rain outside vaccination centres doing that. And that's credit to the people of Wokingham who come forward when needed, really to help those who are less fortunate in the community. So for me, thank you to Pauline, but you know, very much the work goes on until this is over and this is finished.
Ulla Kryn.
Thank you, Chairman. I have a question for Charles, and I have some comments on the report. Which one do you want me to take first?
Charles, and then the report.
Okay. So, Charles, comparing Wokingham Borough to other local authorities, how well are we doing in respect of vaccinations and tests?
I think vaccinations, vaccinations, our GPs are working really hard and they're doing everything they can with the supply they're getting. The issue that's been holding us back slightly has been the supply of vaccination and the inability of the CCG to give us forward forecasts. My understanding at the moment is that probably 2/3, towards 75% of Group 5 have now been vaccinated, which is mainly being done at the Majewski Centre. And the GPs are getting stuck into Group 6, but this is a big group and it's likely to go on for probably till early April. We are trying to help them as much as we can, providing volunteers, as I mentioned before, providing buildings, you know, trying to resolve their problems basically and keep them fully focused on the main prize. We are hitting the government target. My understanding is we're at least equivalent to other areas. A point of frustration, as I've mentioned all along, basically has been the CCG not wishing to share figures publicly about who they're vaccinating or what the forward situation is. That remains the case. We got a letter, oh gosh, a week and a half, 2 weeks ago from Matt Hancock and from Robert Jenrick, which basically said that, as the leader referred to in his opening remarks, councils are going to be expected to play a much greater part in the vaccination programme. And I actually wrote to the Chief Nursing Officer at the local CCG last week, you know, with some requests that they provide us with a certain level of information. Now, I haven't had a response to that as of yet, basically, but I'm going to be chasing for a response because we think that's public knowledge and we as the council are responsible to the people and we want to make sure basically that the residents of Wokingham Borough get vaccinated as quickly as possible, and we're going to keep on pushing basically to make sure that happens. So in summary, the best answer I can give you is my understanding is we're on top, we're achieving the central government targets. On what I get, the information I have, which is largely anecdotal, we're slightly ahead of our neighbouring boroughs. Our GPs are working as hard as they can, but you know, the hold up so far has been vaccine supply. So we're simply saying to the CCG, give us more vaccine, we'll get it into more people's arms, and give us more information to help us with our planning.
Thank you very much, Charles.
No problem.
Pauline, I recognize that this is a report where you all worked very hard, but I do have some comments. To start with, I'm not happy with the first sentence in respect of Children's Services, where it states that the Children's Services team amended its service delivery to ensure that children and staff were safe, schools and settings were supported, etc. That gives the impression that this was not the case before, which definitely is not true. And I would very much like to have that sentence amended to reflect that Children's Services officers have all the time ensured that children are safe and the schools and settings are supported. my other point is that there is nothing in this report about the COVID winter grant money provided for free school meals, where we made funds available to support over 2,000 children and young people in the borough who received means-tested free school meals. And we also supported care leavers and other families. And finally, in respect to mental health, the report does not mention that the council, in partnership with the clinical commissioning group, commissioned CORTH to give counselling support to children and young people online, children between 10 and 25 years of age. And I really think these things should be in that report because they were very important. So those are my comments. Thank you. Oh, and I realize that it's an autumn report, but the counselling service was in place before. So even if I can accept that the COVID winter grant was not meant to be in there, it wasn't an oversight, I do think the other points should be addressed, please.
You're on mute, John.
Pauline, are you still there? Pauline?
I am still here. I temporarily got dismissed, but I've come back. I have got my phone on, by the way. So if I get cut off again, I'll just pick my phone up. But yes, I am still there.
Did you hear my points, Pauline?
Sorry?
Did you hear the points I made?
No, I'm afraid I didn't. So would you mind just summarising them again?
Well, basically, I'm not happy with the first sentence in respect of children's services, where it stated that the children's services team amended its service delivery to ensure that children and staff were safe and the schools and settings were supported. I'm not happy because it gives the impression that this was not the case before. And as you know, that's definitely not true. And I would like that to be amended. And my other point was about the winter grant, but I just realized that, of course, that happened after. So my final point then is in respect to mental health. As you know, the council had commissioned in the early autumn the CCG to help to give counselling support online to children between 10 and 25 years of age. And this report doesn't mention that.
Thank you, Ulla Karin. We can't change the report because it's been completed, but what I suggest you do is, in terms of whether you agree it tonight, that you ask for those things.
I'm sorry, I can't hear you.
Jen.
You disappeared again, Pauline.
Jen. Oh, sorry. Don't bring mine in.
You are frozen, Pauline, and we can't hear you.
Wayne, far away.
Yeah, thank you, John. Thank you, Pauline. Most of what I was going to ask, John Kaiser has already answered, so thanks for that, John. I think we need to just remember and say thanks to Susan and the team. If we go back a year where we were looking down the face of the barrel of financial ruin, and how difficult it is to take a situation where employees have been used to working from an office and then you convert all those people into working from home. That is an unbelievable task. Having done it many years ago in my previous career, it is very difficult. So I think praise needs to go to the team at WBC. I'm sure you'll lead that way, Susan. But also the way they've interacted with community groups and volunteer sectors has also been fantastic. I know from the planning team how they reacted, considering we thought we were going to have a downturn in planning, but we haven't. The amount of planning applications were as high as 2020 as they were in 2019. But I'd just like to say thank you very much, Pauline, for the report, and well done to the team at WBC and the fantastic community spirit we had throughout. I mean, it's not ended, but I think we've got a brighter summer and potentially a near normal autumn. Thank you.
Very good.
Thank you, Chairman. I just wanted to say how pleased I am the amount of focus that the report has given to mental health across our community. We know that coming out of this COVID crisis, and particularly coming out of repeated lockdown, there is going to be a significant impact on the mental health of our population. I'm pleased to see just how much focus the report has given to that. I'm even more pleased to see that the council has already started acting upon the recommendations that have come back from the community survey, which is excellent, both in terms of engaging with Mind and bringing Mind to our community, but also in the mental health first aider course that I was also very lucky to attend, and I'm really pleased to see so many of our council officers have taken the opportunity to do that. My own personal opinion is I think going forward, because this is going to be such a focus for our community, that all of our councillors should go through that mental health first aider training as soon as they can, and I would like to see a lot more of our officers going through it as well. But I'm particularly pleased to see that focus has really come through from our residents, and the council has acted on it straight away and is really taking it forward for the future. So thank you.
John.
Thank you, Leader. Pauline, I just want to say I felt it was a very comprehensive report, and I've got no questions to ask of you, but if I may, Chairman, could I ask a question of Charles Margetts?
Please.
Charles.
Yeah, go ahead, John.
Right, Charles, it's around the BAM community and the reluctancy of vaccination in some areas. Are we doing anything to ensure that we set examples and we involve the communities in the vaccination programme?
The answer is yes. Basically, we are trying to target positive messages to them, basically about the safety and security of the vaccine programme via the forum, basically, and other routes. I know this is something that comes up, regularly at the meetings with GPs, and they're also taking steps to try and do that. I think, to a degree, this relates to the earlier discussion I had with Ulla Corinne, though, that the lack of information we've got from the CCG about who they're actually vaccinating and what the actual situation is kind of holding us up slightly in this area. And the letter I referred to earlier actually asked specifically for further information about how many people are being vaccinated on terms of ethnicity, in terms of whether male or female, age, background, so that we can really sharpen up our messages and be more targeted in these areas. So the answer is we are taking the steps we can based on the information we've got, and if we can get a bit more information from the CCG, we'll certainly be doing more.
Thank you. Maybe Leader, maybe you'd like to ensure we take it up with the leaders of these communities. They're very influential in a lot of cases because they're very tight, close-knit communities.
Yes, indeed. Parry, do you have anything to say about that? Parry?
Yes, thank you, John. Yes, thanks, John, for raising that. It's a very interesting point you raise, actually, that some sectors of the BAME community are reluctant to come forward. They are afraid of various myths which are being bandied around, unreasonably so. And if I can comment on the Sikh community, I've spoken to the leaders of the Sikh community. They have come forward and they're doing everything they can to persuade people to take the vaccines, and there are certain sectors of the community which are still reluctant, and I think that the positive messages that Charles is actually putting out would help. And there was a workshop done not so long ago with the involvement of the GPs and the members of the BME communities, and similar positive messages were driven home, but I think there is still a certain sector of the BAME community which are still reluctant to come forward, and I think that perhaps we need to step out of the box and find out ways of approaching these hard to reach communities and do better. Thanks.
Charles?
Yeah, I just wanted to come back briefly on that. I mean, I'd refer anyone, members or anyone listening, to the video, showing my age, the clip, basically video clip that was circulated on the council's website and PR piece by Amit, the GP from Woodley, a member of the BAME community, who's encouraging, you know, all people to come forward for the vaccination. It is 100% safe. There is no reason not to have it, and it will protect you from COVID-19. So I think the message is very much, please come forward. And, you know, as I said earlier, basically, when we get a bit more information from the CCG, we'll be trying to sharpen up our message even further to make sure it reaches as far into the community as it can.
Thank you.
Thank you, Charles. And thank you.
If there's nobody who wants to add anything, may I sum up? May I sum up? Firstly, it's almost exactly a year since we had our first COVID case. It was coincidentally February the 29th, which is not 4 days away because it doesn't exist this year, when I was alerted to the first case of COVID in the borough. And I have been extremely proud to be the leader in this period. Almost as soon as the first case happened, the officers organised themselves into gold, silver and bronze, and the emergency planning regime kicked in, and we had previously been working on encouraging officers to be bold, innovative, and not be frightened of making mistakes. And we were in a completely new situation, and we made mistakes. We involved everybody, the voluntary sector, the health sector, talked to everybody we could, encouraged voluntary groups, and I must say that by and large we did a pretty good job. And I know the report really talks about the COVID to the autumn, but we've done a fantastic job. And my thanks go to the fantastic GPs that we have, the phenomenal officers who've stepped up to the plate, the voluntary sector, which has performed out of any stretch of the imagination, and all the volunteers and voluntary groups who supported our community so well. In the calls that I've made, I've had nothing but praise for the borough, and it is bold to say that the borough has reacted in a way that is exemplary towards the rest of the local authority community. We stepped out of line on a couple of occasions, the most famous of which was the decision to not follow the government's lead on getting people into care homes to protect our care homes, and I was expecting to be locked up by the boys in blue. But it's a very commendable story, and it's a great deal of credit to our chief executive, our deputy chief executive, the directors, and my executive team, who's performed in a way which I couldn't have expected. So thank you to all of those groups, but also thank you to you, Pauline, for the work on ONS. One of the objectives of this administration was to strengthen the ONS and the democratic levers in our community. I know that ONS is essentially critical of the executive, and So it should be, because it's an aid to our decision making. So we've done great strides with ONS under your tutelage, and I thank you for that. And it's been an amazing job, and it serves to extend the transparency and the strength of our borough. Thank you. Pauline?
May I just say in conclusion, and thanks everyone for all your positive comments, but in conclusion, I'd just like to say that the Overview and Scrutiny Management Committee will be receiving fairly regular reports on the other things that the council is doing to address this awful COVID problem. And my thanks to all of the officers and the members who've been involved in doing these things.
Thank you very much. And unless anybody's got any other business, at 8 o'clock, it's exactly 8 o'clock, I conclude the meeting.
Chair, sorry, you need to vote on the report. On the recommendations.
Oh, sorry, the recommendations. You're absolutely right. Sorry. Thank you very much, Madeline, for pointing that out. The recommendation of the report is the executive note the officers' responses and agree the recommendations as set out in the Overview and Scrutiny report and contained within this report. And note the officers' responses and agree the 2 additional recommendations submitted by the Overview and Scrutiny Management Committee at its meeting on the 20th of January 2021. Those in favour, please put your hands up. Thank you, then that's carried. And thank you very much, Pauline, for presenting it.
My pleasure.
Thank you. Good night to everybody.
Thank you. Good night.
Good night.
Good night.
Good night.